When I first went to Uganda about 22 years ago, I started off working with some of the local health facilities. So I worked in a small hospital that was run by the Catholic Church, and then I also interacted with the local government facility, and for a while I worked with another medical colleague who had a small medical practice. I think during that time I learnt quite a lot, and I realised that there were some significant gaps in the quality of healthcare that was being delivered. So Yotkom is working in a part of the world called Northern Uganda, which is in sub-Saharan Africa. The area we work in Northern Uganda is an area where there's a heavy disease burden. So we deal with a lot of infective diseases like tuberculosis, malaria, and HIV is common. And then when you add to that a lack of trained medical staff in hospitals and medical facilities, you're creating a double challenge because you have a big disease burden and a very small number of medical people available to treat the patients.
Yotkom is envisioned to partner together to improve access and excellence in primary healthcare in Northern Uganda. However, Yotkom vision is particularly a bit challenging because when you look at the key items in our vision, we need to provide excellence. And of course, excellence is very expensive. Yet we still charge very little so that we also provide access. You see, these two things, access and then excellence, they are actually antagonizing. They cannot actually work together given the vision of the organization. So that is the challenge that we have. Meanwhile, we don't want to deviate from our own vision. So we work hard as a team so that we can actually drive our vision and then see how we can actually help the community of Kitgum.
Like they say, resources are limited, but the wants or needs are unlimited. So we are very much the same, and that we also limited as an organization, but I can say that almost everything came through a lot of faith. When we started the project, sometimes you don't actually have the hope that you're going to achieve it. Sometimes you're very scared of how many people will I even be able to, to treat. Will people come here? So we've been always leaning on God for so much of our activities, hoping that it is possible when we believe in God.
We really consider ourselves to be a family, and we're also a family of faith, because faith is a very important part of our heart. The faith that we have in Jesus, the faith that we have in his teachings, and all of those aspects of the Christian life, we want to see them displayed in a practical way through compassionate care to people who are in need. When you read the Bible, you see the importance that's stressed on helping people who are sick.
The northern part of the country is actually rated as one of the poorest in the country. Yotkom is helping by ensuring it acts as a central point where people can come and get affordable health care and care with love and respect. On top of that, Yotkom is offering day-to-day compassionate care through fundings from Australia and some locally generated revenue in terms of cost sharing with the patients. So it has helped to give access to health care for those who are vulnerable and are unable to meet their own cost of health. As well, Yotkom has supported the local people in very many ways. I am one example. Yotkom helped to raise us through mentoring, training, and giving us opportunities for further studies.
We have also entered into local partnership with the different organizations here in Uganda for the purpose of sustainability. For example, more especially the insurance companies, whereby we have been selected as service providers, and we are very competent, by the way. Due to the good services, the quality of the services that we provide, I think we have attracted a number of insurance companies, and therefore they make payments that will help us to subsidize cost so that even the poorest member of the community can actually afford to access our services. I think it would be a very difficult situation for my community without Yotkom, because we have managed as Yotkom to bring the services closer to the community and also made it affordable to the most needy community. So that means, coupled with the compassionate healthcare program, we have actually touched the life of the most needy community. And without this, I believe that mortality and then morbidity would be higher than what we currently have in this community.
She says there is nothing she would have done if this hospital didn't exist.
Yan Yotkom Dogente active. Yan kay chiri or yakagaman remuchi no doctor pe.
Nam ba ba wa ba wa ya la cho be tu ru ma ba bi ki dai ko na ba wa ba ni ka ni dia ma ngwa na da me lo ba to ren pe chi no be to be na no na la
through our activities as Yotkom, we have managed to reach a number of the needy population and bring services closer to the community. I love my community. I was born here in Kitgum. I grew here. I studied here in Kitgum, and I'm actually working here now in Kitgum. I feel in my heart that I need to work for the good of my community.
And as a Christian, I believe that Christians should really be concerned about social injustice and be concerned about addressing inequality and bringing hope and healing to areas of the world where there's very little access to healthcare, and we can't really do it alone, and we can't really expect the local community who are very poor and spending less than $1.90 US a day on living to also somehow pay for what it costs us to deliver the health services. So that's why Yotkom is about partnership, and I think our vision is really to bring capacity from Australia and add to the possibility of us being able to provide healthcare and make it accessible. We really need that and value that partnership from Australia, from donors who share that desire to really bring equality and equity in access to healthcare services in a very poor region of the world.